If somebody feels or thinks there's something wrong with their breast and they come to the doctor, what does the doctor do? There's exam, and then what else can you do to help identify what's inside the breast tissue?
Well, first thing I'm going to do, as you know, and as we teach our students, to always do a good history and then to do a thorough physical exam. And what's involved with taking a good history is finding out what's going on with this patient, where she is in her life, what's going on with her menstrual cycles, has she started any new medications, does she have any other symptoms that might explain this finding. So I think that's absolutely critical. Then, you know, family history is pretty important, because if she's got a first-degree relative that had a history of breast cancer, well, first off, she's going to be pretty worried about that, and that's going to up my game as far as making sure that I make her satisfied. But the other thing that's pretty important too about her family history is just to make sure that she's aware that there are risk factors associated with her family's health that we may be able to uncover and help with.
When we're talking about risk factors, so we'll be talking about who is at risk to develop it. We've said number one, family history. Number two, age.
Right.
Anything
and number
else?
three, really the biggest risk factor is going to be that you're a female. Because as you and I both know and tell our patients on a regular basis, that 1 in 8 women will be diagnosed with breast cancer.
1 in 8 women.
I know.
That's pretty high. That's pretty high.
It really is. And unfortunately, that means we're all going to have somebody in our lives that we're going to be touched by this disease. And so because of that, we want to make sure that we're counseling our patients appropriately and that they're empowered to come see us if they have questions or concerns.
Tender breast?
Tender breast, that's a tough one, right? Because we know that pain in the breast could be associated with breast cancer, but most of the time it's not. So again, it's about getting the history and finding out, well, are your breasts tender every month before your menstrual cycle? Is this something completely new? I oftentimes have women come and maybe have a little breast tenderness because they've been doing a new workout and they're a little bit sore, and because it's in the breast area, they're very concerned. So taking a good history and then doing an exam and feeling the breast tissue, and just as my experience, I can sometimes really reassure somebody that everything's okay.